We're all good, Ann. Go ahead, Ashley.
There we go. All right. Technical difficulties, but we're here. We're here today on our live. Dr. Polack, our pediatrician and founder of Progressive Pediatrics, will give you a little bit more information about who we are here at Progressive Pediatrics. And if you are interested in a new pediatrician or a new medical home, we are here for you and we're glad you're here. So, Dr. Polack, pass the mic to you.
Got it. Hi, everybody. My name is Dr. Polack. I started Progressive Pediatrics in 2000, so it's been a long time. I love the area. I love Hudson County. It's where I grew up, and that's where I still am. So right now, we're 8 providers at Progressive Pediatrics. We have 2 locations. We have Union City and Bayonne, New Jersey. And we all are general pediatricians. We love taking care of young kids. We see patients between the ages of 0, so right after birth, until they turn 21. And we love taking care of them at all those age ranges. So, what do you think makes us different? In my opinion, what makes progressive pediatrics different is number one, longevity. We've been around for a long time. We know the community, we know everyone who's there. We really focus on our availability. So we do our best to see everyone who calls with a sick child that same day. For well visits, we can see them usually within a few days, up to a week. So we do our best to really stay within those parameters. So if your child is sick, we'll do our best to get them in that very same day. We also have online scheduling. So that online scheduling is super helpful. If your child is sick, you can call us, of course, but you can also just schedule an appointment online. We have a patient portal that we love to use. It's only used for non-urgent issues. So if you feel like you have something really urgent that cannot wait a few minutes, please call us. It's much better than using the patient portal. But I think that the most important thing, and that's what most of our patients say about us, is that we take time to listen. We're not rushing through your visit. We want to talk to you about your concerns. Most parents will come in with a list of questions during their well visits. During the sick visits, we always focus specifically on the issue at hand. But when you come in with a well visit, we often do get a list of questions and we take the time to answer them. We do take most commercial insurance plans. So if you've got questions about that, Ashley can answer them better than me. Please put them in the comments. So the purpose of today's video is really for you to get to know us, but we really want to get to know you too. So if you have a moment, put in the comments if you are in our area, where you live, and what ages the kids are. We'd love to get to know you guys better. So, if you are in need of a new pediatrician because so many practices in our area are currently closing or transitioning to different locations, we want you to know that you're welcomed here. We're here to help make this transition smooth, easy, and seamless. We want you to feel like Progressive Pediatrics can be your next medical home for your children if you'd like to. I just came up with an idea. I know sometimes teenagers, when they come to see me for the first time, they feel kind of uncomfortable. It's a new doctor. Do I really trust them? I don't know what to say. So that's why we have our Instagram and YouTube pages. If you want to get to know us, just watch some of our silly videos and some of the non-silly ones too. You'll know that we really take patient care very seriously, but we don't take ourselves all that seriously. We really have fun at work. And Ashley's smiling because she's the leader there. She's our fun leader.
We do have fun at work.
Indeed. Um, so we want to make sure that your kids feel safe, that you feel safe, and we want to take the time out to answer your questions. So I just want you to know that it's pretty easy to transition from one practice to another. The most important thing is that you tell the current practice, especially if they're about to close, before they close, that you want your children's records. So get them to give you what's called a record release form. That's something that's HIPAA compliant. If you sign it, they have to give your records either to you or to your next pediatrician. Most cases, they'll send it to us by fax. Sometimes they'll give you a hard copy, which can be a little bit difficult to manage, but it's easier for them to fax it over if they can. But don't fret. Even if they don't give you your records on time, we have access to the New Jersey Immunization Network. It's called NJIIS. So we can access that, and all pediatricians are supposed to put the child's immunizations there. So that way we will be able to see what vaccines your children have gotten, what they may be due for, etc., online with or without the records from your old pediatrician. And so there's really no wrong time to switch. If you're in need of a pediatrician now, go ahead and switch. If you're not, you can wait. But our advice, to be honest, is to at least schedule a meet and greet with us, or possibly get yourself to establish care. A meet and greet is when a patient or a parent or a whole family comes in sometimes just to check out the place, like the location. Are you comfortable there? Is it clean, neat? Do we have parking? Oh, by the way, I forgot to say, we have parking in Union City. In Bayonne, it's street parking, but in Union City, we do have a parking lot. So you can come and see the place. You can meet with one of the doctors for a really quick 5-minute visit, just to say, hey, how you doing? Do you like the way we speak, etc. And if you'd prefer to establish care, that's when you would actually need to bring in like the forms that we require for filling out to be a patient at the practice. So we're here for you, and I am open to answering any questions that you have. So if you have any, please put them in the chat.
So, Doc, I do have some questions that can better help inform our new patients or maybe future patients. For example, what are our office hours? Is there anybody answering the phones after the office closes?
Yes. So all of our office hours are on our website, progressivepediatrics.com. But basically, we're in the office from 9 a.m. to 7 p.m. 3 days a week. That's Mondays, Tuesdays, and Thursdays. And Wednesdays and Fridays, we're there from 9 a.m. to 5 p.m. to see patients. On Saturdays, we also work from 10 a.m. till 2 to see patients. And yes, we get a lot of same day visits that on Saturdays. On Sundays, we do televisits. So for 2 hours, Sunday mornings, there's always someone available to see you via televisit, address your concerns. If it's something super urgent, they will direct you. But if it's not urgent, it can often be treated online.
Okay,
Oh,
perfect.
I
And
forgot the after hours part. We do
yes.
have a nurse line. Sorry.
Mhm.
So once we close the office, we transfer our phones over to the nurses line. And the nurses line are very dedicated, super experienced nurses that we've been working with for years. They've been doing this for 25 years. So we really do trust their judgment. However, if there's ever a question or if a patient requests to be seen or to have a doctor call them back, we often do ourselves. So the nurses do reach out to us after hours.
That's good to know. And then another question is, what languages do we speak here at the office?
Yeah, so many doctors and all staff members speak both Spanish and English.
Great. And so another question would be, how can I contact you if I have any medical questions?
Right. So the best way, if it's not an urgent issue, is to please send us a patient portal. Someone monitors the portal daily. So even if you're primary doctor, so even if I'm not working, someone else will answer your question on the portal, but it's not immediate. So it's usually within 24 hours, but it's not immediate. That's why I said if it's something urgent, like your child has 105 fever, please don't give me a portal message. Okay, call the office. Whether we're open or closed, we'll have an answer for you as to what to do.
Perfect. And then another question would be, if I have school forms, how quickly do you complete the forms? Is there a fee?
So there's no fees. We do our best to complete the form the same time that you bring it in. If it's super busy, like in the end of August when everyone wants their forms, sometimes there's a 1 day lag to fill out the form, and we can often email it back to you if you like.
Okay. So I think we covered here our questions. Um, but definitely, like you said, I think if anybody ever has a question, just to give us a quick call or even stop by, someone is always available um, to speak to you and answer any questions needed.
Absolutely, absolutely. And I'm going to be on again next week, next Friday. So if you have more questions, please also bring them in next Friday at the same time, same place. and I will answer them as well as I can. I'm not going to answer medical questions that are specific to any child online, of course. However, I would love to answer your questions about the practice and how things run and work here.
Perfect. So Joanna here has established and left our website, how to schedule. Just in case if you have any other questions that you maybe have questions about the doctor, who they are, you'll see them there, and also our phone numbers to give us a call anytime you need.
Thank you for joining, everybody. Have a great day.
Thank you. See you next week.
Bye.